Well, staying on the pandemic, the Northwest Territories is seeing a rapidly spreading outbreak of COVID-19 with 57 new cases yesterday. Healthcare workers there are struggling to cope with limited resources, so now the Territory, well, they are turning to Ottawa for help. We get more now from Juanita Taylor in Yellowknife.
Here in the Northwest Territories, there was already a nursing shortage before the latest outbreak of COVID hit earlier this week. Now, with the quickly rising case counts, the health minister says they're running out of resources.
We have reached out to both the federal government, to their rapid response surge team, to help us look for additional staff to bring to the Northwest Territories to assist us with testing and things like lab analysis, giving vaccinations and so on. And we've also reached out to the Red Cross for both staffing and equipment.
The latest outbreak began at a Dene Hand Games tournament like this one, held in the remote community of Fort Good Hope earlier this month, where its chief is declaring a state of emergency. And what officials say is most likely the Delta variant. It has now spread to 6 N.W.T communities, and there's no sign of it slowing down, in part because of uneven vaccination rates in the Territory. Health Minister Julie Green is calling it an urgent situation, prompting officials to ask for help from the federal government and the Red Cross.
We've heard that they want to help us, but we don't have any specific details of where and when they're going to arrive and how many and so on. But all of those wheels are now in motion.
Anyone who can't get treated in their community has to get medevac to a larger centre. And the nursing shortage in the N.W.T has forced Stanton Territorial Hospital to cut its ICU beds down to 2 from 4. Health Minister Julie Green says a high number of probable COVID-19 cases in the N.W.T is still waiting confirmation from a lab. Juanita Taylor, CBC News, Yellowknife.